Hello, welcome to my channel. My name is Bridget. I'm a nurse practitioner and a nurse educator. In today's video, we will be going over 5 NCLEX questions courtesy of nursing.com. Nursing.com is an excellent resource if you are in nursing school. They have courses, cheat sheets, practice questions, study plans, sim clocks, have videos, and their courses and videos can guide you through nursing school so that you can consolidate studying and focus on what you really need to know. If you want to learn more about nursing.com, check out my affiliate link below. The nurse is teaching the client diagnosed with polycystic ovarian syndrome, this is often abbreviated as PCOS, about lifestyle modifications for the disease. Which of the following topics is most important for the nurse to teach? So people with PCOS are predisposed to diabetes, being not always. I do know individuals that have PCOS that have a normal weight, but they tend to struggle with weight and fertility, acne, sometimes hirsutism. I will try to put a picture here of what PCOS can look like. And however, this is saying lifestyle modifications. That is your keyword, lifestyle. So strategies for weight loss, metformin is pharmacological intervention, and not all of them are going to be checking their blood sugars daily. So strategies for weight loss is your best answer. This is a lifestyle modification associated with PCOS. And although this may be indicated in some cases, this question does not indicate that the client has been prescribed this medication. And this question does not indicate that the client has insulin resistance, even though, again, they will sometimes have issues with insulin resistance. And increasing sleep is not associated with PCOS. Sleep is important. However, when you're taking NCLEX tests, you want to know the key issues with each condition. It's almost like the bullet points of each condition, and insomnia is not a bullet point for PCOS. A 6-year-old child needs assessment for color vision. Which of the following interventions is appropriate to test color vision of a child this age? Ask the child to identify the color of objects in the room. The Ishihara pseudo-isochromatic book of color plates. Again, try my best to put a picture. That's the one where it's this little booklet and it has numbers within the palettes, and if they have, for example, color blindness, they won't be able to see the number within that color palette. Ask the child to pick out something green and something red for red-green color blindness. So a 6-year-old child, what is their developmental level? Are they able to read yet? Oh, good. They provided a picture. So the Ishihara pseudo-isochromatic book of color plates, it looks just like this. So here you can see that the number is 74. Some people with color that are colorblind to specific colors are not able to see the 74. The most common type of color blindness is red-green, and it's hard for them to tell the difference between red and green. So that's what's happening here. They would not be able to read the 74. It would all just blur together. A physician has ordered a blood product transfusion for a client with a hemoglobin level of 6 milligrams per deciliter. What other conditions would most likely be indications of the need for blood products? Select all that apply. So the good news is the next gen NCLEX is going to give you lab values. However, a normal hemoglobin level for a male is 13.8 to 17.2 grams per deciliter, and for females it's 12.1 to 15.1 grams per deciliter. So clearly this person is well below this level, whether they're male or female. And what other conditions would most likely be indications for the need of blood products? Select all that apply. Polycythemia is having too many red blood cells. Hyperglycemia, thrombocytopenia. Penia is a lack of and not having enough thrombocytes or platelets. It's a granulocyte. Basophils, eosinophils, and neutrophils are granulocytes. They're white blood cells that have little granules in them. Polycythemia vera, sickle cell anemia. Eosinophilia is higher than normal. So plasma is a blood product that can be given to clients with thrombocytopenia to help with coagulation. And your blood has thrombocytes. So if they're low, so by replacing the blood products, if they have thrombocytopenia, that's going to help elevate it because thrombocytes are part of blood. Keep in mind that thrombocytes, platelets, make up 1% of the blood product. And with sickle cell anemia, I actually had a teacher in high school that passed away from sickle cell. And he was very beloved, so may he rest in peace. It's very tragic, but It's just they suffer a lot and they can have many, many complications. A low hemoglobin level, usually less than 7, is an indication for a blood transfusion. Since blood transfusions carry a certain amount of risk, a provider will order them only if blood will improve the client outcome and only after considering the entire clinical picture of the client. Red blood cell transfusions are given to clients with sickle cell anemia to reduce the likelihood of stroke. A client who is 28 weeks gestation undergoes a non-stress test. The results are considered reactive. What does this mean? The baby has normal heart accelerations. So a non-stress test may be performed on a pregnant client after approximately 28 weeks gestation. The NST is non-invasive and involves monitoring the baby's heart rate and movements for a period of about 30 minutes. A reactive test indicates that the baby has changed in heart rate in response to movement, which is normal. You want the baby to react. The nurse is caring for a client who has left-sided brain damage. The nurse knows that the client may have deficits in which of the following areas? The left side of the brain is concerned with language, number skills, reasoning, scientific skills, spoken language, and right hand control. So we're going to say with mathematics, logic, reasoning, and imagination and creativity are right-brained. The left side of the brain controls logic, verbal thinking, linear thinking, and mathematics. If a client has damage to the side of the brain, these areas would suffer. Mathematics is a skill controlled by the left side of the brain, and logic is a skill controlled by the left side of the brain. My affiliate link is in the description below. Again, if you learn more through videos, nursing.com is a great resource and tool for you. If you're the kind of person, personally, I have ADHD, and it was very arduous for me to sit there and read the textbook. I'm a huge visual learner, so having videos available helps out tremendously. Make sure that you hit the like button, that you subscribe, and you turn on that notification bell. Thank you so much.